Yes, oke. Ya, selamat malam teman-teman semua. Om Swastiastu, Namo Buddhaya, Salam Kebajikan. Assalamualaikum warahmatullahi wabarakatuh. Malam ini kita sudah hadir ya di sini semua untuk menyaksikan presentasi dari Profesor Mekhman Mamedov yang kita kenal merupakan seorang profesor di bidang kardiologi dan juga founder dari International Forum of Internal Medicine and Cardiology, dan juga kita sama-sama sudah ketahui juga ya teman-teman ya dari poster yang sudah dibagikan, beliau saat ini juga sebagai presiden dari Cardioprogress yang ada di Rusia, dan juga sebagai editor-in-chief dari International Heart and Vascular Diseases Journal, European Society of Cardiology yang saat ini berada di Moskow, Rusia. Jadi mungkin ini merupakan edisi khusus ya dari Dr. Jack's webinar yang akan disiarkan dalam bentuk bahasa Inggris. Ya, terima kasih ada Megawati Wijaya. Jadi teman-teman mungkin bisa menyimak dalam bahasa Inggris ya, karena pastinya beliau tidak bisa bahasa Indonesia, jadi kita harus menyimak dengan full dalam bahasa Inggris. Nah, nanti kita akan menyaksikan sama-sama teman-teman presentasi dari beliau dahulu, dan setelahnya akan diikuti dengan tanya jawab. Jadi bagi teman-teman yang mau bertanya, bisa juga ya, bisa komen di sini atau di Instagram juga bisa, untuk nanti kami akan sampaikan ke beliau. Jadi tanpa berpanjang lebar lagi teman-teman, mungkin bisa kita mulai ya. Kita undang Profesor Mekhman ke sini. Alright. Sebentar ya teman-teman, mungkin bisa kita tambahkan di sini. Oke. Yes. Yes, okay. All right. Yes, hello, Professor.
Hello, Dr. Jeffrey. Hello.
Hi. Hello. How are you today?
Very fine. Fantastic.
Yes.
Yes.
Yeah. We heard that you are in Russia, in Moscow, right?
Yes. I am in Moscow in a city center. Our institute is the National Research Center for Therapy and Internal Medicine for Preventive Medicine, and is a historical building located in city center, heart of the city, 1 kilometer to Red Square Kremlin. This is the historical center of Moscow. From our institute, 1 kilometer. It's very close to city center. Yes.
Yeah, that's very nice to hear that, especially in the pandemic times when we are really willing to go abroad, but we cannot because of the pandemic. So it's very pleasant to hear.
One of the positive effect of the pandemic is our new relations, but the online online is connections. This is one of the positive side of the pandemic and isolation.
Yes, sure, of course. Yeah. So we are very glad to have you in our forum today in this webinar, and today we are going to hear your maybe your perspective on the pandemic regarding to cardiology service or cardiology healthcare, which we know that we all are affected by this pandemic, especially in the internal medicine and cardiology as well. So most of our patients are reluctant to go to the hospital, and they are afraid to get in contact with any hospital staffs because they are afraid of this virus. So maybe you can give some introduction about the situation in Moscow right now, Professor. How about the hospital day life today, before and after the pandemic?
Jeffrey, thank you very much. Very good introduction. But this coronavirus problem is not only now. This is not only medical problem. Now this is a social problem too, because according to the result of the pandemic and isolation on quarantine, we can see the real situation of our medical cares in the pandemic period. Now we are working. This is a normal regime. Now, like before this pandemic time, but we have some lessons about this pandemic and isolation and current quarantine time. I have this idea for first time. I would like to present a small presentation about cardiovascular diseases and COVID-19. And for followers this discussion, this main topics for cardiovascular care system and COVID-19. What?
Yes, yes, please, sir. Yes,
possible?
we are. All right. Yes.
You have my
Yeah.
presentation.
Yes, yes, absolutely.
Okay.
We are going to hear from the professor audience. So please, let's begin this presentation.
Okay. Thank you.
Yes. All right, sir. I think we
Okay.
have your slides now. Yes. Yes. You may begin to present.
Okay. How you will change? You will change. Yes. Okay. This is the slides.
Yes. Absolutely, sir. Absolutely.
Okay. Dear colleagues, I have this short presentation for COVID-19 and cardiovascular disease and some problems of cardio care system. Next, please, Dr. Jeffrey.
All right. Okay. Please wait. You are going to. Yes. Okay.
Next slide, please.
Yes. Is it changing, sir? We already changed the slides, but
yes.
I'm sorry. I think there is some.
I cannot change. You can change because it's you.
Yes. Yes. We already changed it, but somehow the screen is not changing. So we are going to look after the problem. Please wait, sir. All right.
Okay.
Yes. Yes. Maybe there's something happened. Okay. Yes, we are going to try this once again. All right. Yes. Hopefully we can use this. Okay. All right. Sorry, sir. Yes. Okay. Yes.
Is the last slides, please, for start it.
Yes. Yes. Please wait, sir. Okay. Yes. Is it changing? Excuse me, sir. I think there is some. All right. Yes. Yes. That's the slide.
Okay. The main topics of my presentation is cardiovascular disease and COVID-19. The second main topic is the mechanism of development of cardiovascular complications. The third main topic is the thrombosis and COVID-19. The one of the interesting topics is AC1 inhibitors and ARB sartans and COVID-19 and restrictions for patients with cardiovascular disease after a pandemic period. Please, next, please. Dr.
Okay.
Jeffrey?
Yes, Professor.
Yeah.
Yeah. I'm sorry. I think it takes time due to the lack of slides somehow just lagging. We have changed the slide, but
okay. Okay. Good.
Yes.
Good.
Yes, I think something happened.
You can see here this meta-analysis of 21 studies with 7,000 hospitalized patients. Here you can see analysis of cardiovascular complications in patients with coronavirus infections. As you see, there's genders includes the first is the families, arterial hypertension. This is the main cardiovascular risk factors for complications, cardiovascular complications in patients with COVID-19. Also, type 2 diabetes mellitus, also previously cardiovascular disease, has a strong association with complications in patients with COVID-19. Next, please.
All right, sir. Yeah, I'm sorry because it's like there is a lack of time, so it takes some time, which usually don't happen. So we have changed your slides now, but
okay.
Yes, I'm sorry for this. I
No
don't know what
problem, no
happened.
problem.
Yeah.
Dr.
This
Jeffrey,
is
no
your slides.
problem. I know,
Okay.
I clearly know this is a technical problem. It's not your
Yeah.
problem. Yes. So, Dr. Jeffrey, here, this slide is very interesting slide. This is meta-analysis research in China, where it started this coronavirus disease. So, cardiovascular diseases and risk of heavy occurrence coronavirus infection. You can see two topic: hypertension and cardiovascular disease, and very clearly, very strong association with cardiovascular disease such as hypertension and other cardiovascular disease with the risk of have a occurrence of COVID-19. A lot, about 20 studies for hypertension, about 19 studies for other cardiovascular disease. Next, please. This is all the China research works. So I back to meta-analysis of 21 studies, and you can see which diseases are their predictors for coronavirus infection and cardiovascular complications. So,
I'm sorry, sir. Yes.
no.
Please continue.
Okay, good. This is good. Yes. And you can see arrhythmias, angina, cardiovascular complications, and myocardial damage is the main cardiovascular complication, which is strong predictors for death of patients. Next, please.
Yes.
And the other study in England is the prognosis for the discharged after COVID-19 in England. It's a retrospective study for the discharge before August 2020. And you can see main cardiovascular complications like the diabetes in comparison with the control groups. For all incidents and the first-time incidents is main factors for prognosis in patients with COVID-19 in England. Next, please. And United States, this is data from United States for June, from January to June, for about 6 months in the last year. For 100,000 population. And what you can see here, ischemic heart disease, like to the hypertensive disease, increase in comparison with the same period, but 1 year ago. Is this a social problem? Why? Because the pandemic, isolation, and quarantine led for increase of ischemic heart disease and hypertensive disease. Next, please. In United States, I think there's all countries the same tendency. For as is a very interesting mechanisms development of cardiovascular damage from COVID-19. Here you can see viral invasion to into cell and two ways. First way, the inflammations leads to this damage of microvessels and coronary artery by myocardial endothelial dysfunction and in microvessels vascular dysfunction, and this leads to acute coronary syndrome. The second way is inflammation, also leads to myocarditis and arrhythmias, and they lead to heart failure. And you can see two type of disease: acute coronary syndrome and heart failure. But this is one reason. This is COVID-19. Next, please. So what we can see here is the relation of COVID-19 and cardiovascular systems. Is this
No,
increases activation of angiotensin II, inflammations, vasoconstrictions, and thrombosis. Also, you can see this increase of total troponins and increase of plasma NT-pro BNP. Is you know, these indicators for damage of myocardium. Next, please. And so this very interesting topic for analysis is thrombosis in COVID-19. It's a meta-analysis of 43 studies. So, dear colleagues, you can see this totally deep vein thrombosis and pulmonary embolism in totally in 21% in patients with COVID-19. In intensive care unit, about 31. Deep vein thrombosis, totally 20%, and intensive care units is 29. Also, post humously 35%. Pulmonary embolism, totally 13%. Intensive care units is 19%. Post humously 22%. And arterial thromboembolism just 2%, and intensive care units just 5%. So if you we will analyze this mortality without thromboembolism or with thromboembolism. With thromboembolism, this risk for 10% is high than the control group without thromboembolism. Is a difference statistically. Second, next, please. And one of the interesting topics is the use of AC inhibitors and ARB during hospitalization in COVID-19. You know, this was one of the publications in pandemic period. It was AC inhibitors, uses in the AC inhibitors, and some dangerous in coronavirus patients. But you can see clearly here after randomized patients, which is the continued use of AC1 or ARB or disconnect, there's the same tendency, no difference. Next, please. In next slide, you can see this clear data than mortality in both groups the same. Stopping or continue to use this AC inhibitors and ARB, in these groups you don't find any difference for mortality. So results of this topic, AC inhibitors and ARBs safety for patients with coronavirus infection and cardiovascular disease. Next, please. And the last slides for social problems for cardiovascular care systems. Acute myocardial infarction hospitalization in United States in 2020 versus the same time 2019. You can see this is a hospitalization for acute myocardial infarction decreased last year. At the same time, you can see increase of hospitalization patients with COVID-19. Next, please. And we have registry for 900 hospitals in 108 countries. Frequency of diagnostic cardiovascular tests. This total in worldwide, you can see this April of 2019 and the same time, this present time, in pandemic time. You can see in worldwide decrease of the diagnostic cardiovascular tests about 64%. And in each region there's a difference. For example, in United States and Canada, about 96%. In Far East, also in Japan, in China, 35%. In Western Europe, about 70%. In Latin America, 82%. In Middle East, South Asia, 84%. And in Africa, about 80%. The next, please. Other side, you can see all stress studies, nuclear stress studies, stress EKG, stress echo, stress PET. And you can see this is a similar tendency. About 70%, 80%. It is isolation, there's a pandemic period and quarantine period. Frequency of diagnostic cardiovascular tests is about average is 70% is decreased. And its influence for cardiovascular medical care in all countries and totally for mortalities of our patients with cardiovascular disease. The last my slide, please, Dr. Jeffrey. COVID and cardiovascular disease is tangible of problems. So thank you, Dr. Jeffrey.
All right. Yes. Thank you so much, Professor. I think.
Well, Dr. Jeffrey, just for remarks, for conclusion remarks, you can see this meta-analysis of different countries. This COVID and pandemic, it is not only medical problems, also this is a problem for social problem for cardiovascular care, medical care units.
Yes, yes, absolutely, Professor. So this is global problems, not only one nation problems. So that's why I think it's very good to have this discussion between two nations, between Indonesia and Russia. Especially, we want to know about the condition in your country, about the health service in cardiology, whether there are any differences before and after the pandemic. Maybe you can share with us in Indonesia and what you are going to do to make sure that the service or the healthcare still run like as usual, not getting so much affected by the pandemic.
Thank you, Dr. Jeffrey, for your question. And I would like to divide this pandemic period for 3 periods. Before pandemic, during pandemic, and after pandemic. In March 2020, we only heard these dramatic facts from WHO about the pandemic of coronavirus. And in pandemic period, our medical cares for cardiovascular disease had some problems. Because there are many hospitals in Russia, it changed to a red zone for service of coronavirus patients. Many cardiovascular units they change this profile, and this is a departments for coronavirus diseases and patients. Now, we back to our previous regime. Now, this all cardiovascular units in hospitals, in government hospitals, and this is private hospitals work this previous time. We have not any problem, but now we have many people, many patients with cardiovascular disease because it's isolation time, in quarantine time. We talk it with our patients by telemedicine systems. Now this we work in a normal regime. We have not any problem.
Yes, that's very. I'm very glad to hear that. Maybe you just mentioned about the telemedicine, Professor. Maybe you can share more about this before we go to another question. How's the whole telemedicine is going in Russia, and are there any application or it was done from your hospital? So you are in hospital and the patients at home, or maybe you or the doctors also from home, and then they can communicate directly to the patients without any hospital bridging.
Thank you, Dr. Jeffrey. Yes, before this pandemic period, telemedicine used in our practice in the very with some limitation. Why? Because this for doctors, the main connection, real connection with patients, is the main for for doctors. For me, usually too. So, positive side of pandemic period that we learn all positive sides of telemedicine and we use. And I think this is sometimes we will continue this for use the telemedicine system, because in some case maybe in our patients have some limitation, maybe it's objective limitation, and we can use this combined methods. This is a real connection, and the telemedicine connection is a technology for future, and we will use in internal medicine. For internal medicine, telemedicine, one of the main perspective way for connection with our patients. This Russia is a very big country, very big
Yes,
country, and
we
for
know that.
far distance, for far village, the telemedicine, I think, this will be number one way for connection with our patients.
Yeah, absolutely, absolutely, Professor. We know that geographically, Russia is a really large country. So I agree with your statement that telemedicine may be the ultimate answer for that. Maybe we go
Yeah,
to
yeah,
another
yeah.
question, Professor. You just mentioned about the cardiac diagnostics in your presentation, like echocardiography or the CMR, PET scan, and the other diagnostic procedures. But how about the therapeutic procedures like cardiac surgeries that also must be hit by the pandemic? Are there any differences in the procedure, or maybe not only the surgery but also the percutaneous cardiac intervention? Are there any differences before and after a pandemic, and how do you cope with that?
Dr. Jeffrey, very good and practical question. Thank you very much for this question. This Russia is one of the part of the world, and all tendency involved influence into Russia too. Yes, in pandemic period, in quarantine period, there's a planet surgery for cardiovascular diseases is limited. This surgeries such as bypass grafting is increased about 3-4 times. But PCI performance is in normal regime, and sometimes is increased because for acute care PCI is was the number one choose for our patients. But for surgical patients, this needs some planet for examination. And in a quarantine period, it was this, big problems for us, for our hospitals. And 3 times this performance of the bypass grafting is decreased. But now this station is normal. Now in Russia, both methods, this PCI and bypass grafting, this performed no problems. Now we have this normal use, this normal regime. Previously, before this pandemic.
Yes, yes. Very nice to hear that it already returns to normal. And yeah, we also hope that in Indonesia it will be the same as your country. We will come back to normal soon as possible. And maybe, Professor, we can answer one question from the audience. There is Dr. Megawati who asks about the comorbidities. So usually the patients with heart disease not only come with a single disease. So mostly they have another comorbidities or another diseases as well, like hypertension, diabetes, or another artery or vascular diseases. So how do you see the difference between this trends before and after a pandemic? Are there any heart patients that came with the comorbidities, or only the heart problems? So how do you see the heart diseases in the whole system? So not only the heart, but also the other organs or other diseases like the kidney disease or liver disease. How do you see the problems in Russia? Are there any more patients with comorbidities, or only the heart problems that come to your
Thank you,
clinic?
Dr. Jeffrey. This comorbidities of internal diseases is one of my main topics for research. Thank you very much. I have this book, I have the monography, and 3 epidemiological studies in Russia, in Russian regions, for comorbidities of internal somatic disease. Thank you. So, in real practice, in our practice, about 80% of cardiovascular disease had as is a second or third disease, and you can not find patients with isolated cardiovascular diseases. Uh, More 80% patients have the 1, 2, or 3 other somatic diseases. For example, diabetes, for example, liver disease, pulmonary disease, and you know, according to prospective studies, in patients with comorbidity, the prognosis of coronavirus is a very poor. Then in
No.
date in among the patients with comorbidity was 2-3 times more than in patients with isolated, for example, isolated cardiovascular disease or isolated other somatic disease. So comorbidities really is a very big problem for cardiology, for also for internal medicine. And after this coronavirus period, uh, patients with comorbidity of internal disease really increased. Really increased. Why? Because maybe this immune system, this damage of immune system, maybe this some diseases were this silent, but after this discharge of immune system, this clinical manifestation other diseases is increased. The same time, we have in our patients we can define this in cardiovascular disease, diabetes mellitus, pulmonary disease, and other internal disease. It's a big problem for us. And now, after coronavirus disease periods, it's a need complexly diagnostic of our patients for comorbidity, because the comorbidity is one of the main predictors for death of elderly patients.
Yes, absolutely. We also noted from many studies that, like you said, like people with more comorbidities will tend to have a worse prognosis, especially in COVID patients. So also in cardiac patients, if they came with more comorbids, they will have a worse mortality and morbidity rate compared to the isolated heart disease patients. That's a very nice answer, Professor. And maybe we can go to the next question.
Yeah.
As in Indonesia, you know, the cases of heart or cardiology usually consists of 2 main most prevalent diseases, which is the heart failure, and the second one is the coronary artery disease. So how do you see an increase in number of these 2 entities, if of these 2 diseases in your country, heart failure and coronary artery diseases? Are they increasing during the pandemic of the coronavirus? Since we know from your presentation that COVID-19 can increase the inflammation and hence will induce a myocardial infarction, and then will also exacerbate the heart failure, especially the chronic ones. So how do you see in these 2 diseases?
Thank you very much, Dr. Jeffrey. This really is very interesting question. Heart failure after pandemic period will increase. Why? Because it's not only a connection with coronary artery disease. You know, this is a coronary artery disease, one of the reason for heart failure, chronic heart failure. You know, But now,
Yes.
due to coronavirus complications, heart failure will increase by myocarditis, virus myocarditis. Heart failure will increase by some thrombosis. This is one of the complications of coronavirus infection is the thrombosis. Also, arrhythmias. Arrhythmias also leads to chronic heart failure too. I think about 30% will increase chronic heart failure after pandemic period. Also, at the same time, coronary artery disease will increase too. Why? Because this isolation time, in quarantine time, cardiovascular care was poor. Why? Because the main attention was for coronavirus infection, for coronavirus care. At the same time, our patients did not receive this normal, adequate therapy for coronary artery disease. And since 20%, its symptoms of coronary artery disease will increase too for 1-2 years. And after maybe we will normalization. But heart failure will continue, is increasing. This heart failure will increasing about 3-5 years, in near 3-5 years, is my prognosis. Maybe I'm not correctly say, but my prognosis is that in 2 years, coronary artery disease, this frequency of coronary artery disease will be stabilized, but heart failure will increase in 3-5 years.
Yes, thank you, Professor. We really appreciate what you just mentioned, that there will be an increase in the heart failure patients in 5 years, and the coronary artery disease will increase in 2 and 3 years. So I think we need a further long-term study of COVID-19 patients to assure that this will going on track, and maybe we can find some way to somehow cut the progress of disease, so the predictions will not come true. And yes, I think this is very somehow eye-opening, and we can make further steps in studies to make sure that every COVID-19 patients won't go more or further complicates the existing heart disease. Professor, also there is another problems regarding the vaccination. It was in your country. We know that you're using the Sputnik 5. Also in our country as well, we are going to receive a million of doses of Sputnik 5, and we are going to give also the vaccine from your country, and we are going to give to our people. So maybe you have any insights on these vaccinations in relation with the heart disease patients, maybe before and after the vaccination of the Sputnik 5. Do you see any increase in the heart disease patients, especially the thrombosis, or in relation to coronary artery disease? As we know that one of the other vaccines, the AstraZeneca, is somehow getting more problems with this thrombosis or the blood clot problems. So do you see any blood clot problems with the Sputnik 5 in your country?
Thank you very much, Dr. Jeffrey. Yes, vaccination is now one of the preventive methods for all peoples, for all population, includes these patients with cardiovascular disease too. And this patient with cardiovascular disease is the main risk group for coronavirus complications. And vaccine, yes, sure, this is main now for today is the main methods for preventive all complications of coronavirus in patients with cardiovascular disease. So as you know, Russia is one of the first countries where this planet and now made these vaccines. We have not only a vaccine Sputnik 5, we have 3 vaccines. Now they have very good results, but Sputnik 5 this usually yes, this popular vaccine in worldwide, in Russia too. This is the main vaccine. For example, in our institute, this is free of charge for all patients, for all peoples. This is the main vaccines is Sputnik 5, but we have other two vaccines too. For patients with cardiovascular disease, we started vaccination about 2-3 months ago. We have not any data for results, for conclusion of influence of vaccination for condition of patients with cardiovascular disease. But in Russia, organizes registry for all peoples, includes the patients with cardiovascular disease. I think in one more, in 1 years, it will be clearly demonstrate any effects, positive or negative effects with endpoints in patients in cardiovascular disease. But for according to the results of clinical studies in the third stage of clinical studies, about 90% Sputnik 5 is effective in patients, in all population, in patients with cardiovascular disease too. Side effects only 0.2% in the temporary failure. And we have not any information, as a serious information about side effects such as this thrombosis. Like to AstraZeneca. We have not data about these side effects for Sputnik 5. But this registry is discontinued. We have this very good government control for all side effects in Minister Health Care of Russian Federation. I think in 3 months, maybe in 6 months, we will receive any results, conclusion results for side effects or negative effects of vaccination. So what we recommend for our patients, cardiovascular disease, vaccines or not vaccine? Really, we recommend vaccine because there's a positive effect of vaccine for complications is clearly demonstrated. But in acute period, vaccines is contraindication for our patients because acute period may be some complications. Usually we give for our patients about 3-4 weeks after acute coronary syndrome for vaccination. And in stable time, it's no limitation for use of vaccine, also this Sputnik 5 for our patients too.
Yes, very amazed of your answer, Professor. It's just the same in our country, in which we are using the Chinese vaccine just now, which is Sinovac, and also we wait for the acute patients of cardiac diseases to get stabilized first, and after getting stabilized, then we can give to the patients. But in the heart failure or arrhythmia or coronary artery disease patients, with in acute period, we are not giving the vaccinations because it's really clearly contraindicated, as in your case. So maybe we can go to for the next segment of this webinar, Professor Mekhman. The future of cardiology in the pandemic world. We can see that after the pandemic, we may see many patients using the telemedicine, as you just said before, and maybe like more patients are not going to the clinic like in the past time. So maybe it will be a big change for the doctors and also the specialists in the hospital, which usually encounter many patients in a day. So just now they just have to sit in their office and they look for their computers to do telemedicine. So do you find it like it's a challenge for us doctors to face patients like that, or do you prefer the conservative or in the past means that we can see directly the patients and we can examine and we can give the right diagnosis, or maybe doing another diagnostic procedures like echocardiography?
Thank you, Dr. Jeffrey. Yes, according to this lesson of the pandemic, coronavirus pandemic, we are doctors, we must include telemedicine methods for our patients. Why? Because about 80% of my patients is the chronic patients with chronic diseases. You know, this arterial hypertension, coronary artery diseases, or heart failure is a chronic condition. It is not acute problem. For totally for cardiovascular diseases, only 20-25% need hospitalization for acute syndrome, for acute condition. About 80% is a chronic patients. This is a social and medical problem. So, you know, this is a self-control is one of the main way to improve of condition of our patients. And after pandemic period, we must propagate for our patients to learn this self-control system, because you know, it is 50% of effect of our prescription, our medical medications, or all things, our recommendation is depend of the self-control. Now, after pandemic, we must stimulate our patients for good, excellent self-control. It's the first. And second, when our patients, our chronic patients, very well know that in which condition may be crisis, for example, for arterial hypertension, of angina or arrhythmia. We must recommend for our patients by telemedicine. Is it possible? Is it possible? Some our recommendation, advice, and all things. See, I mean about 50-50, maybe
50-50.
50%. Our patients is a need real doctor control in real connection, and about 50% in future maybe we will change to telemedicine control. It's possible. It's depend.
Yes.
It's depend of our patients. If our education of our patients is education of patients is the main factor. When in portion of education, patients with high education, it will be very good for improve of the control by telemedicine.
Yes, really great to hear that. We understand that, like you said, there are certain percentage of patients that cannot do the telemedicine because of education and also the infrastructure. Maybe they are lacking of the internet connection, and maybe they don't have the computer or the gadgets. So that is still the difficulties that we are facing in Indonesia. Especially geographically, we are in archipelago, so most of our countries region are in islands, so it's really difficult to reach the people in the islands, which usually they don't have any infrastructure that is good enough to make a telemedicine consultation. So I think we are still far to do the telemedicine in our country, but maybe we can see this as opportunity for healthcare, especially cardiology healthcare, to improve the prognosis of our heart disease patients. And also, Professor, we have one last question. This is
Dr. Jeffrey, I am sorry
yes.
for discussion. Is a webinar my discussion. I understand what you say. We really in Indonesia there's many islands, it's small islands, and
Yes.
we have not this real connection with the patient. What I recommend for you, for example, every year, maybe every year, you must organize this screening for cardiovascular disease, for other social problems, for example, for diabetes mellitus, for oncological disease. For example, every year you must organize for elderly patients, for example, from 30 to 60 years, screening for risk factors and this social chronic diseases. And after you have some information, who need the telemedicine advice, who need the telemedicine control. You understand me? It's improve all medical care system in Indonesia. The screening every year, screening, regular screening of elderly patients will be very good resolve of the problem for defined and preventive, primary, secondary preventive of cardiovascular disease. It's my view.
Thank you. Really appreciate your suggestions. Maybe we can apply it in our country.
If you need, I can assistance for you. We have very good experience for regions of Russia. We plan it, realizes is a plan for screening for cardiovascular disease and other diseases. No problem. We have very good protocols. We have very good results. We can connect it for realizes the plans in Indonesia too.
Wow, that's very nice to hear that. Thank you so much, Professor Mamedov. We appreciate that.
Jeffrey, it will be free of charge for you.
yeah. We know that. Yes, we understand about that. But really, we really appreciate what you just suggested to our people, and maybe we can apply it as soon as possible. And we hope also, Professor, that after this webinar, we can improve also the prognosis of the heart disease patients in our country, which as you know, that especially for the chronic heart patients, the follow-up is not going well. So most of them are stopping their medications because they cannot go to the hospital because it's pandemic. So they are afraid to go, and there are many protocols that have to be followed if they go to the hospital. And one of the most important procedure in cardiology is echocardiography, which we know, Professor, is very important, as you just mentioned in your presentation. It's one of the most important diagnostic procedures of cardiology. So how do you do the echocardiography in the pandemic times? Maybe this is the last one that may enlighten us how to do the procedure that is taking a long time, a long period. Usually one echocardiography in our country can last like half until 1 hour. So it's a long time. It's really not a brief exposed to the patients. So how do you protect yourself as the cardiologist, and how do patients protect themselves from contact with another hospital staff that are doing the echocardiography?
Dr. Jeffrey, if you remember my presentation, about 70% in worldwide, all diagnostic tests is decreased, about 70% in worldwide. In Russia, it's similar. But for us, main diagnostic test is electrocardiogram at rest. It's the first step for us. For example, for me, as a cardiologist, first step for me is electrocardiography at rest. The second step, echocardiography. Why? Because electrocardiograms is at rest demonstrate for us all functional disorders and anatomical. For example, for acute process is anatomical disorders. What's the main lesson for echocardiography? Echocardiography, for example, very good way for diagnostic of heart failure, for organ damages of hypertension patients, for after myocardial infarction. For me, is a second step. So in isolation time, currently, because we have not any chance for organize this echocardiography for our patients. Main method was electrocardiogram at rest.
Yes, Professor. Really glad to hear that you're choosing the electrocardiography. But how about in COVID patients? Usually they have an acute decompensation of the heart failure. In this case, you should do an echocardiography, an emergency echo. How do you perform that to the COVID-19 patients? Maybe you wearing the complete
Dr. Jeff, I understand.
protective equipment.
In pandemic period, in all hospitals, one department works in the normal regime. In one
Yes.
department, in all hospitals. For example, hospital change about 80% department change to red zone for coronavirus patients. Two departments follow it as a normal regimes for acute patients. And yes, this is the performance of echocardiography is very limited, but it was possible for acute period patients.
Yes. Are you wearing the complete personal protective equipment, like the full hazmat, like that, Professor, to perform that? Because it takes a long of time, right? It takes like almost 1 hour to perform one echo.
Why?
And
Why? Not about this need about 20 minutes.
20 minutes only. But it's still it's a long exposure of time to the COVID-19 patients, so it may increase the rate of infection from the patients to the doctor. So how do you protect the doctor which is performing?
This incidence of the infection of coronavirus infection in Russia, in all lactoses of world, doctors and medical workers, it were number one risk for coronavirus infection and complications. Why? Because we have this real connect.
Yes, sure, absolutely. That's why we are very concerning, because in our institutions, we almost postpone all like the procedures that takes a long time, because we want to avoid the exposure from the patients, Professor, because it's very risky. It may increase the rate of infection within the hospital, which we don't want it to happen, because we already have the shortages of hospital staff, and we still have many patients to manage, so we don't want to sacrifice our hospital doctors. So yeah, maybe this may like giving us some suggestions on how to do the performance, especially the ones that takes a long time. So thank you so much, Professor Mamedov, for having you this evening. It's really a nice conversation, really an enlightenment for us Indonesian people, especially in cardiology fields. And it's really a pleasure to know the future of heart, or the future of cardiology after the pandemic, from your presentation. Maybe you have any closing statements, or you have something
Thank you, Dr. Yes, I have for some remarks. First,
please.
my remarks, positive side of this coronavirus pandemic is that I published my English book for cardiology, 500 pages. This book I prepared with connection with Oxford University, and with my American colleagues. Is my book, Cardiology Basic Aspects. I will send for you present for me. Okay, 500 pages and 3 appendix with electrocardiogram, echocardiography, and coronary abnormalities in patients with cardiovascular disease. It's the first positive side. When I was in pandemic time, is isolated, I prepared and finished my book. And second, I would like to thank you for inviting me to the webinar, because it's very interesting for me for tell about our experience in Russia and heard your experience in Indonesia, and when we result that the main problems the same in our countries, the same problems, because we are part of the world tendency, in a global tendency. And my last remarks now, Dr. Jeffrey, this holy Ramadan month for Muslims, I know this Indonesia is a Muslim country too. It is a
Yeah,
different
we are the
culture.
largest one.
Yes,
We are
yes,
the
but now
largest
as
Muslim
a Muslim,
country.
I am Muslim too, but I don't keep this diet. But I respect my respect for my colleagues, Muslim colleagues, which is keep this diet in whole Ramadan. I would like to wish this safety and luck for our colleagues and for family in the whole Ramadan time. And my last remark for you, Dr. Jeffrey, thank you. This is a very good idea to connection by webinar, by online for cardiovascular disease problems. I think in future we can continue this connection for different topics for arterial hypertension, for comorbidity patients with cardiovascular disease and diabetes mellitus, with pulmonary disease and other somatic disease. We have very good experience. You have this experience too. We can connect, we can change our ideas. It will be good for science and practical works for our doctors too.
Certainly, it's really a pleasure to have you maybe in the future sessions with another topics that you just mentioned. We are looking forward for that. Again, thank you so much, Professor
Thank
Mamedov.
you. And,
We really,
I was in many countries of Asia, but I don't was in Indonesia. Since when we will be offline regime, when we will be this normal regime, you can invite me to your Indonesian conference of cardiology, and with kind I will come to Indonesia because never was in Indonesia.
sure, sure. We will invite you. You should come to our country. We have the best island of the world.
Thank you.
Have the yes, we have Bali. You should visit that one, Professor.
Yes, Bali is Bali is very like this Russian tourist, but I'm not tourist. I am a Russian.
Yeah.
I have not. I
Uh,
have not. I have not time for vacation for Bali. I would like to come to Indonesia for a connection with my colleagues.
all right. Yes, yes, that works as well. Maybe we can have a meeting and as well as a vacation in Bali because
Maybe. Why not?
yeah,
Why not?
yeah. Usually they have both in our countries. So pleasure and also meetings for cardiology. So a pleasure to have you, Mr. Professor Mamedov. Once again, thank you so much. We appreciate your lecture today. It's really enlightening us, the people of Indonesia. Thank you, Professor.
Thank you. Thank you.
Thank you so much, Professor.
Thank you.
All right. See you again and in the meantime, and hope the best for you.
Thank you.
Yes. All right. For all of the audience, we have heard from our professor, Professor Mamedov, which already give a presentation about the cardiology and the future of this field after pandemic. Also, we know that the professor is one of the founders of International Forum of Internal Medicine, which consists of internists and the cardiologists. So we also heard the perspective on internal medicine as well from the professor. So for you that is not having the opportunity to see this presentation from the beginning, you may watch the session in our YouTube channel and also in our Instagram channel at Dr. Jeff Aloys. After this event, we will upload it to our social media channels. So stay tuned and stay healthy and see you in next Dr. Jeff's webinar.